Dr. Bruce Weinstock graduated medical school from BU, attended residency in pediatrics at Brown University, Rhode Island Hospital, and fellowship in pediatric emergency medicine at BU's Boston Medical Center. He received a master's in public health from BU and is certified in general pediatrics and pediatric emergency medicine. Over his career, he has worked as a pediatric emergency physician and served in a variety of other pediatric roles, including clinician, education director, chief of service, quality assurance officer, and director of clinical programs for Boston Medical Center, St. Vincent Hospital in Worcester, Norwood Hospital, and Boston Children's Hospital, as well as Mass General Hospital for Children. He's on faculty of both Harvard Medical School and Boston University, and has served on the Emergency Medical Services for Children Task Force for the Massachusetts Department of Public Health. Since the development of the COVID-19 pandemic, he has served as an advisor for the Synagogue Council of Massachusetts, the Jewish Community Day Schools of Greater Boston, and multiple synagogues in Minyanim, as well as our very own 384 campus. These experiences have exposed Bruce to a variety of discussions, challenges, viewpoints, and strategies which both synagogues and Minyanim have been facing and using to safely engage congregants during the COVID-19 pandemic. Bruce is an active member of KI and has been affiliated with KI since 1979 as a toddler, when he began leading Shabbat Junior congregation services. He has in the past served on KI's board. He lives on Lawton Street with his wife, Lisa, who attended KI Hebrew School, if you can believe it. They have 3 adult daughters ranging in the age of 20 to 27 years old. And Bruce has been a new and dear friend, certainly in my journey. And I am excited to turn the reins over of the webinar to Bruce.
Well, I'm delighted to come and speak with everyone tonight about Congregation Kehilloth Israel and COVID-19 safety. You all can see with the picture at the bottom of the screen, it's been a long time since we saw our sanctuary filled to that degree. Hopefully it won't be so much longer, but it's very hard to tell, which is what lots of people say about this virus. This virus, we have learned more about this disease process in modern medicine more quickly than we have learned about any disease process in the history of medicine. And yet, there's still so many things we don't quite know and don't quite understand. And much of our challenges has to do with not only dealing with what we know to be unsafe, but also the things that we just don't know whether they're safe or not. And so what I'd like to do in this presentation is first go through the things that we know, because the things that we know inform what we do here at KI to keep ourselves safe. And then I'll go a little bit through the things that we think we know, but we're not so sure about. And so we have to react to them even though we lack some element of certainty. So what do we know? First, we know the distance makes a huge difference in the risk of acquiring droplets and COVID-19. So COVID-19 generally gets spread by a bunch of COVID-19 sitting on large droplets and then making their way from one person to another. Mask wearing by someone who has COVID-19 makes a huge, I have to repeat, huge difference in reducing the risk of spread to others. Mask wearing by someone who doesn't yet have COVID-19 and is trying to not get COVID-19 works pretty well, but not nearly as well as if the mask is worn by someone who has COVID-19. And even better if they both wear it. Now, if the people combine wearing a mask by the one who's spreading, wearing a mask by the one who's receiving, and there's a distance of greater than 6 feet between them, then the transmission of any large droplets becomes extremely unlikely, which means that the passage of large amounts of COVID-19 becomes extremely unlikely. Under certain circumstances, transmission can occur by contact with objects that have been exposed to large droplets and can occur by prolonged exposure to many, many small droplets. But these are far less common than large droplet exposure. And frankly, these modes of transmission are less well understood as well. What else do we know? We know that an infection is acquired when a person receives and acquires a very large number of virus particles. But they don't get infected if they only get a few virus particles. So the amount that's transmitted really matters. The virus particles can enter through the mouth, through the nose, through the eyes. If there's a cut, in theory, they could enter through a cut in the skin, but they really can't go through the skin. The skin itself cannot help them acquire COVID-19. But areas of their skin, particularly their fingers and hands, can transmit that COVID that's sitting on the skin to the nose and mouth and eyes, and that's how someone can get the disease. COVID-19 can be spread by large droplets when we breathe, when we talk, when we chew, when we sneeze, when we sing, and all of this is the most likely cause of COVID-19 transmission. Many COVID-19 particles can be carried on a single large droplet. So under normal inside conditions, large droplets from breathing, coughing, talking often travel up to 3 feet, maybe 4 feet, rarely beyond 6 feet, except for if they are projected with force, such as might occur during sneezing, spitting, or shouting without a mask. Now, a few things that we believe with pretty strong evidence, but we're really not quite certain. The more COVID-19 particles you acquire, the more sick you're likely to get. So even if you get COVID-19 from someone, the less exposure, the better. Also, it is difficult to acquire COVID-19 from surfaces unless those surfaces still have moisture from the large droplets. This is most likely to occur with hard, non-absorbent surfaces like door handles, faucet knobs, countertops, stairway banisters, and much less likely to happen with paper or cloth, such as what covers our cedarene or our talacine. However, it's fairly likely with cloth that's purposely used to absorb moisture, such as wet towels in a bathroom. If objects are given sufficient time to air dry, the COVID-19 is going to die and there's almost no risk of transmission. There's only risk from person to object to person, to mouth to eyes to nose. There is almost no risk from person to object to another object to a person, unless moisture is also transmitted between the objects. So if you handle a sea door and then you place that sea door on top of a second sea door, maybe the sweat on your hands will allow the first sea door to become a source of infection for a few minutes till the moisture is absorbed, but the second sea door is not going to be a mode of transmission of COVID-19. Small particles of moisture which can float in the air and travel much further than 6 feet can also carry COVID-19. But because they're small particles, they can only carry a few virus particles. So you need many, many, many of these small particles to get enough virus. And you simply can't get many, many, many of them with a breath or two. You need to have a long period of time of breathing air that has many, many of those small particles in order to get infected with COVID-19. What else do we believe, but we're not totally certain? Masks help a lot with small particles, but they don't work as well for small particles as for large particles, and small particles can sneak in the sides of masks, and they can sneak out as well. Small particles are created by all the activities which make large particles, including breathing, but they're markedly increased when someone whispers instead of talking, or when one sings loudly, or one talks loudly. Small particles quickly distribute to fill the container they're in. Because they're light, they don't fall to the ground with gravity the way large particles do. This makes outdoors much safer than indoors. And this is obvious. Outdoors is a very large container. So the particles quickly distribute everywhere, and they become very, very dilute. Good indoor ventilation can markedly reduce risk from small particles, unless the room is very small and you happen to be sitting in the direction of airflow downwind from someone spreading small particles. Even so, you have to be there for a very long time to get enough small particles. In large rooms, there's just so much airflow in multiple directions that this really is not a risk. Those with high-risk medical conditions are not more likely to get COVID-19 than anyone else, but they are more likely to have worse illness if they get COVID-19. So given these ideas and principles, how did KI and the 384 campus develop its protocols? It started with a medical advisory committee that made recommendations to the 384 campus COVID-19 safety committee, which represents all the campus partners. For this safety committee, we use the abbreviation ICS, the Incident Command System. The COVID-19 Campus Safety Committee made the final decision regarding guidelines and protocols. The COVID-19 Safety Committee accepted basically all the medical committee recommendations and made some additional guidelines based on official recommendations to houses of worship from the state and other organizations that gave input to synagogues, and input from the state itself, input from the Department of Public Health. And the COVID-19 Safety Committee also considered the expectations of congregational behavior and attitudes toward risk, as well as knowledge of the campus resources. We put everything together that we know about us, combined it with the advice from the committees and the state resources, and came up with our protocols and guidelines. Here you see listed the members of the Medical Advisory Committee. Among us, we include physicians experienced in emergency medicine, in safety management, in security, in pediatric infectious disease, internal medicine, intensive care, nurse experience with school care, mental health, and hospital care. And we asked Rabbi Hamilton to serve on the committee as well, because many of our decisions would have halachic implications, and we felt that Rabbi Hamilton understood the greater community far better than any of us as individuals. The members of the COVID-19 Campus Safety Committee are of two tiers. The first tier are the names you see on this screen, people who represented 8 of our many congregational partners. Many people from these partner organizations brought other members from their organization in, even though you don't see my name listed here as any representing any individual organization, because I do have affiliations with actually all of these organizations, with the exception of the KI preschool. I sat on the committee as well. We had Rabbi Hamilton join us as well. And so there's other input than the names you see here. But if you're interested who to turn to from your organization, you can either turn to the Barnett in the office directly, who also sat in on the committee, or turn to any of the representatives you see on this screen. So what were the principles which guided the formation of our recommendations? How did we think about what to include? So the first thing is we recognize that new information is constantly emerging, and these guidelines will be revised as appropriate knowledge is increased. The people who've been attending Daily Minyan can tell you this, because each time they attended Daily Minyan, they had to look at a new revision of some of the instructions of how to behave while there. We allow other similar organizations to gather first and use their experience to guide us in terms of assessing what might be safe or unsafe. In other words, we were not the leaders of the pack. We looked at what other synagogues and churches did. We looked, did it seem safe for them? And only then would we go ahead and implement activities that might bring us together in some way. We've devoted ourselves to the principle that as we acquire knowledge which allows us to loosen restrictions based on this new knowledge and observation of others, we'll loosen those restrictions gradually and in a stepwise fashion. We recognize that our campus is a focus for many groups with very diverse demographics and behaviors. And because of that, we need to be more cautious than many other houses of worship. In thinking about our decisions, we think about not only how it impacts our members, but everybody our organizations are affiliated with and everyone our members are affiliated with. We recognize we have a responsibility not only to our own members, but also to the greater community. We ensure we do nothing to lessen the quality of programming available to those who choose not to come to campus. We support and cooperate with local governmental public health efforts. Our relationship with the local government is extremely important. And we recognize that the relationship between local government and houses of worship in some ways is tenuous. Massachusetts was under fire from some religious organizations for interfering with the rights of religious organizations. And therefore, Massachusetts found that they had to not create rules that would curtail the behavior of religious organizations unless they felt there was compelling evidence that that behavior would endanger the public health. This means they allowed some things to happen by regulation that are unsafe for the specific members involved, as long as it would not put the greater community at risk. Recognizing this, we have taken the approach that we do not restrict ourselves only to the behaviors permitted by local government, but we go further and restrict ourselves to behaviors that are permitted of any non-religious organization, a much higher standard. We recognize that attendees will not be 100% compliant with the rules, and therefore a belt and suspenders approach in which we have more rules than are necessary so that multiple rules have to be broken in order for spread to successfully occur. We recognize this is a difficult concept for many members, and they feel that they can tell that something really should not be risky. So why can't we permit it? And the answer here is that we know we're human, and that even me sitting on the committee, knowing all the rules, I catch myself sometimes not following what I should have followed. That's going to be true for all of us. And therefore, we have to have multiple layers to protect us. So I want to make a comment before we move on about COVID-19 risk, because there's been a lot of misunderstanding in the media. The major push, and the reason the entire population was made to feel so scared in early March, was communal concern that everybody suddenly getting COVID-19 would overwhelm the health system. Because the truth is, we have limited beds and limited health system capacity. And if everybody gets the same illness at once, a small percentage of them will get very sick, and the medical system just won't be able to take it. But from the point of view of an individual, for almost all people, whether they have a high-risk condition or not, whether they're elderly or not, compared with the other risks in our lives, COVID-19 is not our highest risk. In other words, if you get COVID-19, within the year, you are more likely to recover from your COVID-19 and be more seriously affected by something else than by the COVID-19. What that something else is depends upon your age and a bunch of other factors. But the point is this: COVID-19 is dangerous. It is a high-risk event. But if you get it, regardless of your status, regardless of your medical conditions, you are more likely to recover from your COVID-19 and then have a problem with whatever your status was before you got your COVID-19, than to be affected seriously by the COVID-19. Having said that, many people will get affected seriously by COVID-19 because it's a statistical probability. It's not a definite answer that you will recover. Put differently, compared with a world in which there's no COVID-19, your risk of a serious medical issue within the year, if you get COVID-19, is slightly less than double than what it was if you did not get COVID-19. So let's put this all together and say, what are the things we need to do as a campus to reduce the risk of getting COVID-19? First is do our best to prevent COVID-19 from entering the campus. And we'll talk more about that in a minute, as we will all of these. Next, reduce the number of people on the campus at any one time and reduce the number of people in any room at any time. Next, increase the distance between people so COVID-19 can't move easily between us. Next, wear masks because they are so effective and particularly effective at preventing us from spreading to others. Next, copious hand cleansing, because if we're doing masks well and we are doing distance well, our next highest risk is our hands sending COVID-19 to somebody else via an object in between. Improve ventilation and air cleansing so that if this small particle issue we've talked about is a real issue, and we believe it is, then improving ventilation and air cleansing will decrease our risk from small particle spread. Minimize exposure time because, as I said, small particle spread gets you when you spend a long period of time in the room with those small particles. Minimize the risk from surfaces by making sure surfaces are as clean as possible, and reduce vocalization. Reduce the activities in which our mouth will create more particles that can spread to other people. So how do we prevent COVID-19 from entering the campus? This is the first and most important line of defense. If it's not here, it can't spread. The problem we face is the highest risk of spread occurs one day before anyone suspects they might be at risk to spread. And so we have to use statistical probability of who might be at risk to spread to be our first line of defense. And so we have attendance eligibility rules. These are posted on the website. They're posted on the campus doors. They're posted at every room. And I encourage you to take a look at them and understand that we know you don't believe you have COVID-19, but if you fall into one of these categories, statistically, you are at higher risk in general, and therefore we ask you not to come. If you go to the website, on the website, you will see, as you scroll down, a page that looks something like this, and you'll see toward the, a little below where it says High Holiday Rosh Hashanah Services, this button which says COVID-19 Safety Protocols. If you press on that, you will see along the right side all the documents that we consider most important for you to see. The top two documents, the attendance eligibility and the attendance instructions, you're required to review those before you set foot on campus at any events. These are the documents that are most important at keeping us safe when we are together. There are some other documents that are there for your interest. You see decision-making premises in case you're wondering how did we get to these instructions. You see a clarification of the mass travel order, which is an order which states that if you've traveled across the state border within the past 14 days, you're expected to quarantine unless you meet very specific conditions, which are stated in detail. Every event on campus will have an event coordinator whose responsibility it is to make sure that the event is running safely. And there's a document that you can see which helps you understand what the event safety coordinator is supposed to do. So let's move on to the various ways in which we otherwise keep you safe other than preventing COVID-19 from stepping foot on campus. The first is we follow the state regulations set at a maximum number of people per indoor room at 25 people. In addition, recognizing that households need to be together and every additional household creates additional risk, we've set the maximum number of households in a room at 15. In addition, there has to be enough space within the room to account for the small particles and the large particles. So we've set a minimum amount of space per person in a room at 100 square feet. That means that rooms under 2,500 square feet will have a capacity that's lower than 25 people. Well, our only rooms with 2,500 square feet are the social hall and the sanctuary. So that means all other rooms will have a capacity that's lower than 25 people. And those capacity signs are posted for every room at their entrances. Masks. Masks are required at all times by all persons, including speakers and leaders. An exception can be made if necessary to briefly drink from your own water bottle. Water fountains have been blocked off so that there's no temptation to remove masks there. While in the bathroom, one might have to briefly remove your mask to wash your face, blow your nose, adjust your makeup. We do ask that you try and avoid that when you are within 6 feet of somebody else. There are times where you can't make it to a bathroom in time to blow your nose, or you know a cough is coming. For those events, we ask you to just step out of the room and get as far from other people as you can, at least 6 feet, and you should be further than that anyway already. If your mask breaks or becomes unusable for any reason, the event coordinator will have access to another clean mask to give you. Distance. We know you hear about 6 feet. However, our observing of human behavior shows we are terrible at judging that. And when we try and be at 6 feet, we usually are at 5 or 4 feet. And therefore, we've set the minimum distance between people at 8 feet. Plus, there is good, solid, documented information that for every additional 2 feet, you reduce your risk by 87%. It is a huge factor in safety to increase your distance. We make exception for this 8 feet for passing and brief communication, brief transporting of objects, and other brief tasks such as bathroom use. In the bathrooms, every other stall and urinal has been blocked off in order to enable increased distance. Hand cleansing. Even the most careful of us is constantly bringing our hands to our nose, to our eyes, to our masks. And if we have COVID-19, there's normally enough moisture on our hands to ensure transfer to our hands and then to other objects, or transfer from other objects. In view of our distance regulations being so strict, hands touching a shared object like a door handle, a stairway banister, a sink knob, or an elevator button within a few minutes of someone with COVID-19 touching them is really the most likely method for transmission on campus, assuming we are behaving regarding our masks and our distancing. If the receiver touches their own face without first cleansing their hands, this is a likely cause of transfer of illness. In addition to distance, cleansing before and after any encounter with any of these objects, before and after touching your own face, is the most important step you can take to prevent the spread of COVID-19 on campus. And to help you, we have cleanser everywhere. We have cleanser near the bathrooms. We have cleanser at the elevators. We have cleanser at the entrance and exits to stairs. As you come in and out of the building, as you enter every room, please use it as often as you need to. Ventilation and air cleansing. The best and safest ventilation is outdoors. Wherever possible, events are scheduled for outdoors. We've upgraded the ventilation system to include MERV 13 filters, which can filter out 95% of all particles greater than 3 microns that pass through it. This will likely remove almost all COVID-19 aerosols as they pass through the system. We plan to open windows when possible. Where it's currently practical, our smaller rooms with less ventilation have HEPA filters as an additional step to aid circulation, ventilation, and air cleansing. HEPA filters do all three. They help with circulation, they help with ventilation, and they help with air cleansing. And HEPA filters are greater than 99.9% effective. We're investigating options for HEPA filters or fans in the large, well-ventilated rooms as well. Not sure that they need them, but if we can get them, we can create an extra ventilation safety margin. And any room with an event greater than 5 people will require 30 minutes afterwards of ventilation before another group can enter it. Exposure time. Again, small particles require a long exposure time in order to get enough particles. So we created a safe limit of 1 hour indoors for any groups greater than 5 people. We're limiting groups of greater than 5 people to 2.5 hours indoor and outdoor combined. Now, admittedly, if they're outdoors, the amount of exposure to small particles is likely to be extremely low. But when groups are together for a long time, we know from observing human behavior, we loosen up on our distancing, we loosen up on our masking. We shouldn't, but we do. And because of that, we need this 2.5 hour limit even outdoors. Surfaces and objects. All high-touch surfaces in any room used by more than 5 people will be thoroughly cleaned by custodial staff after the event and before the next event with greater than 5 people. Individuals are encouraged to take a synagogue prayer book, chumash, yarmulke, talis, use it as their own for synagogue events so that they're not sharing these, and bring them home between events. Any synagogue objects used and not brought home will either be cleaned or they'll be sequestered for 3 days to assure the virus has died prior to reuse. There'll be signs posted adjacent to high-risk environment surfaces, such as stairways, bathrooms, elevators, instructing safe guidelines for use and reminding you before and after you use them to clean your hands. Vocalization. This is the part that we previously understood very little about and are learning about rapidly. It is now well known that increased volume creates increased droplets and aerosols. It's also well known that it's safer to shout with a mask than to talk softly without one. So because of this, we require congregational leaders who are chanting indoors to use a microphone when feasible, the lowest volume necessary for the enjoyment of the congregation, be facing away from the congregation, and to be distanced by at least 10 feet from the closest participant. We require speakers to use masks and be at least 10 feet from the nearest participant if speaking and not chanting. They may face the congregation if speaking and not chanting. If they are the only person in the room, then they may remove their mask. We discourage singing indoors by anyone. We encourage indoor spoken congregational response to be at a minimum necessary level for you to feel that sense of participation in the service. And we encourage singing out of doors to be the minimum volume necessary for your enjoyment. We encourage congregational leaders who are chanting or singing outdoors to use the microphone when feasible, the lowest volume necessary to be heard, to be facing away from the congregation when feasible, and to be distanced at least 10 feet from the closest participant. So what happens if we learn that someone did have COVID-19 and they came to something on campus? The first thing to recognize is because of our other safety measures, even if they did, the risk of transmission to someone else on our campus is extremely low as long as they followed the rules that we stated. However, if this were to happen, we have a duty to notify the Department of Public Health. If the Department of Public Health determines the risk of transmission based on our guidelines and an interview with the infected person is high enough, then the Department of Public Health may ask for a list of who was present. Depending upon the whims of the Department of Public Health and how strict they choose to be and the answers they were given, and a look at our protocols and whether the interview revealed we followed those protocols, the Department of Public Health may or may not ask people who were interviewed or who were present to be interviewed or tested or quarantine, or any combination. So one does have to recognize that by coming to campus, even if you follow all our safety measures, there is a risk the Department of Public Health will contact you and ask you to quarantine. The Department of Public Health will tell us whether or not they believe we should notify others who were present based on their assessment of the risk. If they determine that the risk was minimal, we may not necessarily notify others who were present out of consideration for the personal medical privacy of the person with COVID-19. But if the Department of Public Health considers it to have been a threat to others, then the Department of Public Health will inform us to do so. There's some special circumstances that deserve a little bit of extra attention. First, this whole thing about singing. Just to reiterate, we really don't know a lot about the singing. It may ultimately, as we move forward, turn out to be less of a risk than we think. Based on experience in the rest of the world, it may turn out that singing at distance with a mask really is no risk at all. Despite this, because of our lack of certainty, we think there's enough evidence to say it is safe to sing at low-level volumes, distanced apart with masks. Shofar. Shofar obviously is only a risk if the person blowing shofar has COVID-19. It has been well shown that to minimize the risk of droplet spread, a mask over the shofar can markedly improve the reduction of particles that are spread. If the particles are spread, they will follow the same rules as the rules we talked about before. Large particles will drop to the ground quickly. Small particles will float into the air and float away. Our only risk really with shofar is that it blasts with such strength that we're not sure that 6 feet is enough, and therefore we are recommending to follow the state guidelines for all wind instruments, which is 25 feet. So the shofar should be blown at least 25 feet from the closest participant. What about bathrooms? You've heard a lot in the media recently about people claiming that bathrooms could be high risk. On the other hand, it is notable that as we look at outbreaks, bathrooms have not been involved in outbreaks to our knowledge. And we think this is mainly because people do not spend enough time in bathrooms to acquire the small particles that concern people when they talk about flushing toilets and urinals and all of that. So as long as you maintain your distance from someone while in the bathroom, or are in the bathroom alone, then you should be at very low risk in a bathroom. The main risk is touching surfaces and then bringing your hands to your face before you wash your hands. And then again, since the last two things you're going to do is shut off the water on a faucet, use a towel to do that, and after you leave the bathroom, you're likely to touch the door handle of the bathroom. As soon as you leave, cleanse your hands. Before you enter, cleanse your hands. Regarding food, well, the state has said that no food can be consumed in any house of worship. So we obviously won't have food. We are permitted to distribute packaged food as long as we do so in a safe manner. It is not really clear the degree to which the food itself carries a risk of transmission. Obviously, if a food preparer is not wearing a mask or gloves and touches the food and the food is moist, in theory, it could hold COVID-19. There's still a lot unknown about food transmission. We won't have to deal with that since we are not serving food and you are not permitted to bring your own food into the building, only a water bottle if needed. Travel. There's a lot of controversy regarding the Massachusetts travel order. It is an order which has lots of holes. It is an order which requires people who have been very careful to quarantine, and there are many situations in which people who have not been careful are permitted to not quarantine. That said, in a large public health maneuver, statistically, it is an order that will reduce the amount of COVID that enters the state. And because of our relationship as a trusted house of worship and our relationship with local government, we are solidifying that relationship with local government by supporting the travel ban. The travel order, excuse me. We therefore ask you to be aware of the travel order and its details. And if you do not qualify to be on campus according to the travel order, please do not come to campus. Regarding children, it's amazing how little we still understand about the role of children in COVID-19 transmission. We do understand in large numbers, children simply don't seem to get the serious effects of COVID-19. It's true that in rare circumstances, children get this other thing, this multi-system inflammatory disease, but that's extremely rare. Their far greater risk is crossing the street. And so the main issue is we know children have COVID-19. We don't know how much they get sick from it, and we don't know how much they transmit it, except we know they do. And so given this total lack of knowledge, we've decided as a campus that for community events that are not specifically targeted to families with children or to the children themselves, in order to protect others, children are currently below age of bar mitzvah, not welcome yet. Hopefully, as more information becomes available, we'll be able to more easily welcome them into our events. The final special circumstance I want to talk about is testing, because there's a lot of misunderstanding about testing. In our environment, regarding a house of worship, testing simply just isn't useful. The problem with testing is that the rapid tests are generally antigen tests, which mean that if you have COVID-19, they're wrong 30% of the time. That is way too high an error rate to consider them reliable. And if you are going to get the molecular test, which is reliable, between the time you are tested and you get the result, there is so much opportunity to get a new infection by COVID-19 that by the time you can safely come to shul, you're no longer safe to come to shul because the result is already outdated by the time you get the result. COVID-19 testing has its role in medicine, it has its role in public health, but in helping an individual know whether they can or cannot spread COVID-19, it's simply useless. It can be helpful in letting us know whether they could have in the past spread COVID-19, so that there may be situations in which you are asked to be COVID-19 tested because of your having been on campus, but there is no COVID-19 testing that protects you enough to say you will not be a source of infection if you enter onto campus. So finally, some resources that can help you with your journey through COVID-19. One, I encourage you to look at the KI website. Take a look at the various COVID-19 documents that we have available and that are listed there. There's not only the documents on that right side of the page that I showed you, but there's some other documents embedded and links to them in the body of the text. So feel free to look there. Look at the government website on COVID-19 for its updates and information. Look at the Brookline Department of Public Health website. If you're interested in state trends and national trends and international trends, here are two of my favorite trackers to help you with those things. Finally, the Synagogue Council of Massachusetts has a number of COVID-19 related resources that are worth looking at. We will soon make available to you some other resources that are very, very good. Resources put out by the Jewish Theological Seminary, resources put out by a number of other faith organizations. And finally, I'm one of you. Give me a call. You have some questions, you're not sure about something, you want to know what to do, then give me a call. I do have to stress, however, that neither I nor the event coordinators are in charge or able to make exceptions for the protocols and guidelines. We're merely transmitting them and carrying them out. If you have questions, you can ask us. If we know the answers, we can answer. But if you're looking for an exception, that does have to go through the COVID-19 Safety Committee. And the only reason we imagine an exception would be granted is if you think of a circumstance which somehow we didn't think of, or there's new information that has come out that we have not yet dealt with. So that's the end of my presentation so far. Give me a call if I can help you, and I'd be delighted to take any questions that anyone might have.
Can you unshare the screen?
Yeah, I'll try and do that.
Great job.
There we go. Thank you. Well, I did a good job. No questions.
Could you just go over one more time the groups of 5 or more inside are the maximum gathering time is 1 hour inside.
1 hour inside, yes.
And then outside is what?
For the campus as a whole, it's 2.5 hours. So if it's an outdoor program entirely, it can be 2.5 hours. If it's a combined indoor-outdoor program, it can be 2.5 hours, as long as the inside part isn't more than an hour. Other questions? Well, thank you very much. I appreciate having the opportunity to share this with you, and I'm around. Let me know if other things come up.